And a warm welcome on Drungtsho BBS in English. I'm your host, Tilayang Chundoji. We're indeed fortunate to resume Drungtsho BBS in English after a long break, and especially in the era of the new normal. Drungtsho BBS is aired in 2 languages, Dzongkha and English, on BBS2. The program provides an effective platform to raise awareness on pertinent health issues and for the well-being of all. We have certified clinical doctors and other medical practitioners to talk to us on various health and medical topics. Their insights and medical advice are valuable to the show. I am pleased to begin this new season of Drungtsho BBS in English on the 6th of March. To coincide with a special day in the international medical calendar, 6th of March is celebrated as the Dentist Day. It is a day to show our appreciation to the dedicated work played by a dentist. I'm sure you all know when you have the slightest of toothache, who do you miss? The dentist. So without further ado, we have a very popular guest on our new season. Dr. Gyan Bajgai is a dental surgeon with the Jigme Dorji Wangchuk National Referral Hospital. You have seen him plenty of times on Drungtsho BBS in Dzongkha. So a very warm welcome on Drungtsho BBS, the first episode of the first season, Doctor, and happy Dentist Day.
Thank you so much for inviting us to this Drungtsho BBS program, English program. In fact, reviving this program, I think it would be really useful to our public, because we have listeners throughout the world who see BBS. In fact, when I was in Thailand, I used to continuously watch BBS too. So there are people outside Bhutan also who watch BBS too. So I hope this program will be of some benefit to them. At least they can get some tips. So along with that, coinciding with the 6th March, that is Dentist Day, we have revived our Drungtsho English program, which was once there, but somehow it failed in between. Drungtsho BBS Dzongkha was a success, but we could not continue with the English program. And now, from now, I hope we can do really well. And thank you so much for wishing Dentist Day. In fact, this day was observed some 230 years ago in the US. Actually, this is a US Dentist Day. So we also follow the same day here in Bhutan. And the purpose of celebrating this day is, one is to express our gratitude to the dentist, and also to remind ourselves how important our oral health, our dental hygiene is, our dental health is. So whenever this year comes, every year, we should remind ourselves that our oral health is important, and we really need to take care of our oral health.
What inspired you to become a dentist?
I wanted to be a doctor, and I didn't know what a dentist was. That is the fact. So after my 12th, when we went for the interview, I was called for the interview, and then they asked me, what do you want to become? What do you want to take up? Then I said, I want to be a doctor, medical doctor. Then they told me, oh no, we don't have the seat now. We had only this many slots, and just before you, the candidate took the seat, so you don't have the seat. Then I said, okay, then I'll wait for 1 more year, and then I'll go next year. That time they told me that they talked about something called this Bachelors of Dental Surgery. I didn't know, in fact, I didn't know about what was Bachelors of Dental Surgery. Then I asked them, what is Bachelors of Dental Surgery? They told me that it is same as MBBS doctor. You will be placed in the same grades, you'll get same opportunities, you'll be a doctor, all those things. So I would say it was my fate that made me a dentist and an oral medicine specialist now.
Nice. So what is a day in the life of a dentist like?
Yes, in fact, life of a dentist is a hectic life. We have to begin our day as early as 8:30 a.m. in the morning, and sometimes it goes on. And we have to see a lot of patients who come with pain, some crying. So, like, we have to see a lot of ailing patients. So, it needs a lot of compassion, love, and care to be a dentist and to treat a patient. And it is, in fact, at the end of the day, it is your happiness. You're happy, your patient is happy, your patient doesn't have any more pain. So when you see all these things, it's a good thing, lah.
So, Doctor, dentistry has evolved with better technology and connectivity. So, how has that helped you in your profession?
Yes, with the modernization, we have also developed a lot, lah. In fact, my seniors used to say that they used to work bare hands without even gloves. They used to see the patients, but now we have all the facilities, and we have really digitalized. We have digital x-rays, we have histochemistry, blood investigations, CT, MRI, everything. We can diagnose a patient at a very early stage. Even if it is a cancer, we can diagnose before it becomes a cancer, like in a pre-cancer condition, provided the patient comes to hospital on time. So we have the facilities, we do biopsies, and we have other investigations. And now our x-rays are this orthopantogram, or these are digital x-rays. We have digital x-rays, and we are also planning to improve further. We are planning to put newer things. And although in other places there is laser dentistry, we have already proposed for the laser dentistry also.
That's very good news for all of us.
So we are hopeful that we'll have the laser soon. So we have good facilities, and this has really helped us.
They say that a dentist can truly fix a broken smile. So how rewarding is your profession when you see that happening?
Madam, now, yes, dentistry is a rewarding job, I would say. For example, now if you are a patient and if you broke your front tooth, of course nowadays we have masks, you can cover it. But imagine the psychological stress you'll have. Similar type of patients, we get a lot of patients. And we have something called immediate denture. Then we have self-liners, we have composite fillings. So we do all these things, which makes patients happy. Even today now, somebody suddenly is walking, he falls down and breaks his front tooth. We have the option, we can immediately give the treatment. He can fix the tooth and go home.
What are the common cases that you see in a day or in a week? And another question with that is it true that most dental problems don't start with pain? So we're not as aware?
Most common causes of dental visits is, number one is decay, tooth decay, dental caries. This is very high. In fact, a few years back, one of my seniors has done a study among 5 to 6 years children. It shows that there is some 80% caries in 5 to 6 year old children.
Wow, 5 to 6 year olds.
Yes, and I have done one study, I have published also. 2019, I was with the elderly care program. So by default, I was with the program. I collected all the data, and then I did a small study. And in that study, what I found was quite interesting. Like among Buddhist people more than 60 years of age, the prevalence of tooth loss, starting from 1 to complete loss, was around 81%.
That is high, Doctor.
Yes, very high. And among the 90% who had teeth, dental caries was around 46%. So I would say number one cause is dental caries, and its complications that makes our people to visit hospital, number one. Number two is we have periodontal problems. Periodontal problems, that is gum issues, gum problems, gingivitis, and it can happen because of different reasons, gum problems. Then we also have oral cancers, pre-cancers. Oral cancer is quite high. As per the 2015 cancer report, head and neck cancer was 4th highest cancer in Bhutan.
Head and neck.
Yes, it was like just next to stomach cancer, cervix cancer, and colorectal cancer. It was 4th highest. And we have a recent study that shows it is 3rd highest cancer in Bhutan. Head and neck includes oral cancers also.
Wow.
And apart from that, we also get a lot of patients coming with oral problems, glossitis or ulcers in the mouth, and it could be because of different reasons, and of course, road traffic accidents, fractures, jaw fractures, assault, battery
So as a
cases.
surgeon, you would be looking into all these
Yes,
cases.
we see almost everything. We see almost everything. But so far we have not started reconstruction. If the patient needs reconstruction, we need to refer them. But we do see all the cases. Even cancer treatments we do here. So cancer cases, pre-cancers, and other thing is we have even salivary gland problems, and jaw problems, jaw drop, jaw dislocation. All these problems are there, pulpitis. But the most common ones are dental caries, periodontal problem.
So, doctor, would you say then these severe dental problems are caused by poor oral health?
Yes, it is definitely poor oral health. Poor oral health, and especially among us, our oral hygiene is quite poor. It's because of poor oral health. And like now, if I ask anybody, do you brush your teeth? He or she might say, yes, I brush twice a day using this toothpaste. But probably the technique is not correct, or they are not using the proper toothpaste, or they are not using the proper technique. Or either they are not brushing, don't know, all these things you have to consider. Not only that, your oral hygiene, other things, like gum infections, it can be hormonal. So when your body is immunocompromised, you can get other infections. So poor oral health, especially this now with the increasing incidences, cases of diabetes and hypertension and other lifestyle related diseases, we have a lot of patients coming with problems.
Yes, this leads us to another question. A healthy mouth leads to a healthy heart. Could you elaborate on that?
Yes. Healthy heart leads to healthy mouth is correct. Because if you don't have a healthy mouth, your heart cannot be healthy. And now if you say there are some diseases which happens because of dental problems, oral problems. There are some infections like infective endocarditis that is followed by a dental infection or something, infective endocarditis, all these things. And the other thing is now whatever you eat or drink has to go through your mouth. So if your mouth is not healthy, your body won't be healthy, your heart won't be healthy. And if you talk about other infections, yes, mouth diseases, periodontal problems increases the risk of cardiovascular diseases. So that is true. A healthy mouth leads to a healthy heart.
So, doctor, I wanted to stress on periodontitis. Is it called a gum disease, normal term? And how many people have it in your practice? How many do you see?
Anything that ends with itis is inflammation.
Inflammation. Oh,
it can be gingivitis, it can be periodontitis, it can be anything, pulpitis, anything. Now, once the problem starts, for example, let's say gingivitis, gums problem, there can be many reasons. It can be bacterial, it can be because of the dental plaque, improper brushing, not cleaning properly. Even not brushing properly can lead to gingivitis. That's called plaque-induced gingivitis. Okay, there are other causes of gingivitis, of course, hormonal and autoimmune. There are so many causes.
Nice.
But now, when the gingivitis, that is usually the signs and symptoms of
it's the gum swelling.
Yes, signs and symptoms will be there will be swelling of the gums. They will complain of bleeding gums while brushing, or bleeding, especially when early in the morning when they wake up, there is blood something, or while eating apple or some hot fruits, there will be some bleeding. These are indications of gum inflammation. There will be swelling, redness, all these things will be there. So the normal color should be pink in color.
Gum.
Yes. Now, once it is infected, it becomes red. It becomes red. It is inflamed. That is, it is swollen. It is swollen, and it has very easy tendency to bleed. This condition is gingivitis. So if you do not treat gingivitis, then this progresses to periodontitis. Periodontitis is basically the inflammation of the supporting structures of the tooth. So it is gums, gingiva, then periodontal ligaments, then the bone, supporting bone, alveolar bone, all inflammation of all these things is periodontitis. Now, if you don't treat periodontitis on time, the patient will lose his or her tooth.
On the topic of losing your teeth, is it true that 1 in 5 cases of total tooth loss is linked to diabetes? Would it be a fair statement to make?
Exactly no, because this should be all based on studies, like research.
Yes.
We do not have any studies done on this topic so far.
Okay.
And
But having diabetes does
yes,
harm.
yes, diabetes. Now there are studies. There have done studies, researchers. Diabetes is related to gum disease, periodontal disease, or even hypertension. Because what happens in diabetes is the resistance to infection decreases. There is more infection. Because the patient has sugar in his blood already, so the bacteria can easily feed on those sugar, and the resistance that is the wound doesn't heal fast. Wound doesn't heal fast, and there is some sort of ischemia, all these things, and this infection can actually like say they have linked to this periodontitis and diabetes. They have found links. I saw some studies which says like diabetes could be related to periodontal problem, periodontitis, or periodontitis could be related to, but still we are not sure whether diabetes can cause periodontitis or whether periodontitis can cause diabetes, but it does affect both the ways.
So now it's time for the audience question.
Yes,
So we have two questions from the audience. The first is, why is flossing the teeth important?
Let's see, like what we usually do is we usually brush our teeth like this only, like this.
Just back and forth.
That is the most of our people do that. This is incorrect. So the reason why we need to do flossing is whatever is stuck in between the teeth, we have to remove that one. Whatever is stuck in between the teeth, we have to remove whatever is stuck. So you do the flossing here, and the brushing is in circular motions. You have to place your brush at 45 degrees angle to the gums, like this. Then with small stroke, circular motion, you have to move back and forth, back and forth.
Small circles.
Yeah, small circles. Small circles, back and forth. You have to go back and forth like this.
Less.
And then you have to repeat the same thing on the inner side also. Inner side also. And then on the chewing surfaces, you have to do on the chewing surfaces. And when you come to the front teeth, to clean your front teeth, you have to brush like this. Like this. Otherwise, this area accumulates lot of calculus plaque. So this area you have to brush, and you have to follow the same technique on the other side and on the upper teeth. And nowadays what we say is, earlier we used to say 3 to 5 minutes brushing. Now we say, like as per the American Dental Association, 2 minutes twice a day with proper toothpaste, fluoridated toothpaste that is accepted by ADA. Fluoridated toothpaste we have to use. So if you brush your teeth at least twice a day, 2 times, it is sufficient. But now coming to the question, flossing, most of our cases what happens is the foot stuck in between doesn't come out.
Between the two teeth.
Yes, between the two teeth. For example, this two teeth, okay, especially in the back teeth it happens. If the food is accumulated somewhere here, and with the normal brushing, if it doesn't come out, you need to do flossing. So you remove the food debris from here.
Okay.
And later when you rinse properly, everything comes out.
So the floss comes with wax also, I
Yes,
believe, no?
yes, it is. Some floss comes with wax, some is without wax.
Right. And
So-
you recommend that we buy proper floss
Yes, yes,
and not use a piece of thread or something like that.
Because
which,
what happens is if you use a piece of thread, it might break. And
Yes.
it might stuck again there.
Causing further
yes,
dental woes,
causing further damage. That can happen.
Yes.
And the last thing I would like to say is also, in good toothbrush, you'll have a rough surface on the back.
less.
So you have to use this surface to clean the tongue. Dorsal upper surface of the tongue. And if you do not have that one, you can use the brush.
Brush itself, the bristles.
Recommended brush is soft bristled brush.
soft bristle.
Soft bristled brush. And you have to change your toothbrush once the bristles start to fray.
So they go like that,
yes,
right?
once it
Less
starts
than-
fraying, then you have to change your
Less.
toothbrush. So if you say time 3 to 4 months, it
3 to
depends on how you use, how strongly you use.
And
also.
some people brush really hard, doctor.
It is
Would
not
you,
recommended.
It's not recommended.
No, because now using hard brush and brushing hard causes abrasion here. The tooth material goes off. And a person starts getting sensitivity. So once the tooth material goes, it starts becoming sensitivity. That's why we advise them to use soft bristle brush, not to use too much pressure, not to brush for half an hour, Because we see some patients like
Half an hour.
yeah, I have seen some patients as soon as they get up in the morning, they start brushing, and they will be brushing. They go to toilet, wash their face, everything. Still, they will be brushing. That is not permitted. That should not be done.
Yes.
That will cause more damage. So follow proper technique. 2 minutes, twice a day, soft bristle brush, and then use fluoridated toothpaste.
Yes.
Because now why I'm stressing on fluoridated toothpaste is we have other toothpaste in the market which doesn't contain fluoride. And for us, especially for us Bhutanese, the source of fluoride is only from the toothpaste. We do not have any other sources of fluoride. We do not have water fluoridation, we don't have salt fluoridation, we don't have milk fluoridation, we don't have tablets, lozenges. Of course, in the hospitals, we have topical gel and varnishes that we use for children or anybody who is very prone to dental caries. We do have, it is applied professionally. We do not give to patients. So when we see such patients, like if they are very prone to caries or even adults, we use these varnishes.
Yes. So, doctor, in the market, there's also nowadays electric toothbrush. Do you recommend that?
Yes, there is no harm in using electric toothbrush.
For 3 to 4 minutes.
Yes,
Yes,
no, timing, now time thing is really, it is a controversial thing. Now what ADA recommends is you can brush for 2 minutes. 2 minutes is okay.
But you have to get all the teeth.
Yes, you have to clean all the teeth. Circular motion, it has to reach all the teeth. Even the chewing surfaces, insides,
and
everywhere.
if you have the time, the tongue as well.
Yes,
you
and
clean.
not time
Some people are in a rush to brush.
At the end of brushing, at the end of your brushing the teeth part, you have to clean the tongue.
Yes, so don't rush brushing.
Yes, don't rush. 2 to 3 minutes. Take 2 to 3 minutes, brush properly.
Yeah.
And now many people might ask, like even I used to go to schools and then ask them, let's start post-lunch brushing. And they always told, we don't have water. Now we don't have water problem because of COVID-19. We don't have water problem. We can start that one.
Yes.
At least we can observe our children brushing at least once in front of their teacher using a fluoridated toothpaste. That can really reduce the burden of dental caries, dental decay, especially amongst our children.
That's a very good idea, doctor.
Yes, and the fact is, after brushing, you really don't need to rinse your mouth. You can just spit out. So if you just spit out, it's okay, because now you are using that fluoride that has to work topically on the surface. If you remove all the fluoride after brushing with thorough rinsing, then there is no fluoride to work on your cavity. The advantage is now people might ask, because they will have this queries, why we need fluoride, fluoridated toothpaste. Because the advantage of fluoridated toothpaste is it is anti-caries, anti-decay. Number one. Number two, it helps in forming stronger structure, tooth structure. It helps forming calcium fluoroapatite crystals, which are more resistant to bacteria, which are more resistant to dental caries. So that is the advantage of using fluoridated toothpaste. So we recommend, please go for fluoridated toothpaste.
So what about the case in children, the fluoridated toothpaste?
Yes, now since younger children swallow toothpaste, it is sweet, they swallow toothpaste. We usually till the age of 7 or 8 years, we ask parents to guide them brushing.
So they don't swallow the fluoride.
Number one. Number two, the amount of toothpaste that we use in children is less. You have to use just a pea-sized toothpaste for the children. We can use adult toothpaste, there is no problem. Amount has to be less, just pea-size. In case of adult, what we do is like we put all over the bristles all over. In case of children, we have to just use maybe pea-size or half of that, and monitor them. If they swallow a little bit, there is no problem. But if they swallow more, there are problems. Like again, there can be fluorosis, other poisonings, things can happen. But with the topical thing, with toothbrush thing, until and unless they eat whole tube, there shouldn't be a problem. So we can use adult toothpaste. And nowadays we have recommended toothpaste for children. It comes from Bangkok, even it comes from India. They can use that one for children. Else they can use the normal toothpaste that the adults use at home.
The second question from the audience is kind of answered, because it says, why do teeth bleed when brushing? And I think doctor has adequately said that, if you brush too hard, and if you have underlying condition like gingivitis also causes the teeth to bleed. So is that okay, doctor? Do you want add anything to that?
Yes, one of the causes of bleeding gums is hard brushing also. use of hard brush. That is one cause which we underestimate. It is unnoticed. Whenever they come with bleeding, we always think of some severe problem. We do not think of the local problems. We have to think of the local problems. There can be a lot of local problems in the mouth. Gum infection can cause bleeding, just a simple gum infection, okay? And then hard brushing can cause bleeding. Then we can go for other things, systemic conditions. Certain systemic diseases like even diabetes or some leukemia, all these things can have these manifestations. So bleeding, when the patient comes with bleeding comes, first thing is we have to rule out the local causes. Local causes, you have to see whether there is any calculus, dental plaque, which when they don't clean the teeth properly, that causes inflammation of the gums and it bleeds. Number one, local cause. So before we go on to the systemic cause or to the deeper thing, we have to find out the local cause, treat the local cause, then we can think of other things. If you really think it is not because of this one, then we can think of autoimmune diseases or even systemic diseases we can think. But the most common cause of gingivitis is in our context is poor oral hygiene. That is presence of dental calculus or presence of dental plaque in the mouth. But there can be other complications, other things also which we really need to look into, and it depends on cases.
Pregnancy and dental care. How important is it for pregnant women to take care of their oral dental health?
What happens in pregnancy is during the pregnancy, certain grade of low grade inflammation is present in our body. So when we do studies which requires to study some biomarkers or for the inflammation, we exclude pregnant women because there is low grade inflammation already in the body, number one. Number two, because of the hormonal changes, gums swell, they can bleed, sometimes they develop even gum infection, gingivitis. And the most important thing is poor oral health can lead to premature and preterm births. So the child will be low birth weight child, and preterm deliveries can happen because of poor oral hygiene. These are actually proved by studies. So it is very important to take care of oral hygiene during pregnancy. Taking proper care during pregnancy is very important for the mother's health, for the health of the child in the womb.
What are the good food and drinks that you recommend should help us with our good oral health upkeep?
Yes. Now, basically, when it comes to food and drinks, anything that is good for the body is good for the tooth also. That is green leafy vegetables, fruits, and of course, we should take meat also. Meat is important because our system is such that we also need meat. If there is deficiency, we can have ulcers.
B12, I believe. You get B12 yes, from the
B12
protein, animal protein.
Yes, so we need that one also, but that deficiency needs quite a lot of long period. But we need to see that thing also. And the foods that we should avoid is junk foods. We have to really avoid fizzy drinks, chocolates, carbohydrates, ice cream, so many things.
How about dark chocolate?
No comments. But I think as long as it is sticky and it sticks to the tooth surface, it is better to remove. And anything that is more acidic. Acidic can also cause erosions on the tooth. So too sour things, too much sour. Like some people have the habit of taking a lot of sour things. That one you have to avoid. So fizzy drinks you have to avoid. Fast foods, snacks, carbohydrate, refined carbohydrates, cakes, these things, if possible, better to avoid and go for natural vegetables or fruits, which is good for the body. And other thing is good for tooth and bone is even, of course, calcium milk. I would like to add here no betel products, because when we ask our patients what they say is no, I don't chew doma, but I take rajnigandha or sakila. These are all tobacco products or betel products. And these betel products also contain tobacco. So it's always better to say no to these things.
Yes. Thank you very much, Doctor.
Yes, thank you so much.
We will wind up here. We have a disclaimer at the top of the program which says that, for your personal health issues or concerns, it should be brought to the attention of doctors and healthcare providers at your nearest PHU or hospital, because you have to get a thorough checkup physically so that doctors can make evidence-based diagnosis. So You can listen to us here on Drungtsho BBS English, but you should also go and visit your doctor to get proper diagnosis. Well, we bring you sound medical advices from clinical doctors, and you have to arm yourself with knowledge about your health and well-being, and I hope Drungtsho BBS serves to do that. Thank you for watching.